Number 9. PARP inhibitors for prostate cancer.
With a 1 in 9 chance of diagnosis, the disease is an ever-present worry for men. Researchers are constantly looking for new options for prostate cancer resistant to therapies, including metastatic castrate-resistant prostate cancer, or mCRPC, which is considered incurable. Known for their success in women's cancers, poly-ADP ribose polymerase, or PARP inhibitors, have recently shown success as a targeted cancer therapy in men with similar BRCA gene mutations. While chemotherapy damages DNA as a way to hurt and kill rapidly dividing cancer cells, BRCA genes have a built-in backup plan to repair cancer DNA. PARP proteins fix this damage, allowing the cancer to grow. The inhibitor of PARP prevents repair, effectively blocking cell growth. FDA approved in May were 2 PARP inhibitors for treatment of mCRPC in patients with these DNA repair mutations. In clinical trials, these therapies have demonstrated improvements, such as a 66% reduced risk of disease progression or death. While prostate cancer continues to affect nearly 200,000 men per year in the U.S., the emergence of PARP inhibitors for this indication is an enormous advancement in the treatment of the disease.
Hello, this is Akhil Saklecha from Cleveland Clinic Ventures. We are now at number 9 on our top 10 medical innovations list, PARP inhibitors for prostate cancer. With me today is Dr. Moshe Ornstein, staff genitourinary oncologist in the Taussig Cancer Institute at Cleveland Clinic. So Moshe, we just watched the video on this treatment for prostate cancer, but it's not really new in cancer treatment overall. Can you tell us a little bit about PARP inhibitors and their relation in other treatments for ovarian cancer and breast cancer?
Sure. So first, by way of introduction to PARP inhibitors in general, cancer cells divide and proliferate and grow by way of their DNA. And DNA can be broken. And the cancer cells have ways to repair their DNA. And there are multiple different pathways to repair DNA. There are more well-known pathways of DNA damage repair, such as BRCA pathways. And then there are other pathways, such as PARP pathways. So in patients who have damage in their DNA repair mechanisms, really in many tumors, so for instance, patients with BRCA mutations, where their DNA, the cancer DNA doesn't get repaired by way of BRCA, the cancer DNA can now shift and get repaired by way of PARP. And that's where PARP inhibitors come into play, specifically for patients with breast cancer and ovarian cancer. And generally, we think about PARP inhibitors in patients who have BRCA mutations or other DNA damage repair mutations, because that's when the cancer DNA is really fixed by way of PARP. So you have a patient who's got a mutation that does not allow fixing of their DNA by a BRCA pathway. The DNA would, in theory, be fixed by a PARP pathway. You come in with a PARP inhibitor, and you don't allow that DNA to be repaired, and the cancer DNA can't replicate, the cancer can't proliferate, it doesn't progress, and ultimately that's how patients are helped. And we know a lot about PARP inhibitors from the GYN oncology field in ovarian cancer and breast cancer, where it's been shown to help patients and improve their clinical outcomes. And it's only recently in 2020 where PARP inhibitors have come into play in terms of FDA approval in prostate cancer, although their development has been underway for many years in prostate cancer patients.
So there are many unique options right now for treating prostate cancer patients. We have surgery, we have radiation, hormone therapy, immunotherapy. How does this fit into the big picture? When do you consider targeted treatment?
It's a great question, and it's a question that we as a field are asking. We know we have these treatments that are some more toxic than others. What sets PARP inhibitors aside is the fact that they're selected for a specific patient population within prostate cancer. So for patients who have metastatic prostate cancer, where the goal here is not to cure them, but to prolong their life and maintain a good quality of life. The foundation of treatment across the board is androgen deprivation therapy, and that's lowering their testosterone levels. And that treatment is the backbone that will be a part of their therapy throughout their disease course. Along the way, and especially for patients whose cancer is getting worse despite low levels of testosterone, and these are patients with metastatic castration-resistant prostate cancer, the primary other treatments that we've thought of historically and over the last 10 years or so have been chemotherapy, which in some ways is a one-size-fits-all approach. We've thought about novel androgen pathways, whether it's drugs that target hormonal pathways via the adrenal axis or other androgen receptor pathways. And again, those are really a one-size-fits-all kind of a general approach for all patients. PARP inhibitors are really only going to be appropriate for those patients who have these specific mutations in their DNA damage repair pathways. Now, figuring out where exactly they fit in terms of before chemotherapy or after chemotherapy, before certain novel androgen receptors, these are data we're still sorting through, and some of the drugs are approved in specific areas based on the trials that were done in those settings. But in general, what really sets PARP inhibitors aside is the fact that it's a targeted therapy for a subset of patients who have specific mutations.
Now, do side effects play a role here?
Absolutely. Whenever we're talking about cancers such as metastatic castration-resistant prostate cancer, what we call metastatic CRPC, where we know that we're not able to cure patients, but rather prolong life and maintain their quality, we always have to consider what the toxicity profile is going to look like. And that's another area where PARP inhibitors can be really helpful in this subset. And the reason for that is these are pills that patients can take at home. They don't have to be in clinic to take these treatments. So whereas chemotherapy is more toxic and patients think of chemotherapy as nausea and hair loss and other classical chemotherapy-related side effects, PARP inhibitors are pills where they're not coming in for infusions. They're taking them at home. They can travel and take these medications, and they're generally fairly well tolerated. So in addition to being very specific for patients and a real targeted or precision oncology approach, it also has benefits in terms of side effect profiles.
Great. And probably more importantly, how have you seen PARP inhibitors affect patient lives and impact patient lives? Is there any experience you've had that's been meaningful for you?
Yeah, absolutely. You know, I have a patient that comes to mind where this patient had been previously treated with other agents, and only relatively recently were we able to get their mutational status from their tumor and send off to be able to find that they had one of these mutations that made them eligible for a PARP inhibitor. And the ability to see that patient who had to kind of endure the typical chemotherapy side effects and difficult side effects with other treatments, and suddenly to be able to say, this promise of precision oncology where we're giving drugs because of specific DNA mutations, and to be able to help that patient by just giving them pills to take at home and to see the clinical benefit the patient had was really remarkable and just shows how far we've come in the treatment of metastatic CRPC.
Great. Well, I want to thank you, Dr. Ornstein, for taking the time today to talk to us about PARP inhibitors for prostate cancer, which is number 9 on our top 10 medical innovations list.
A pleasure to be here, and thanks for the invitation.